Hey guys, this is Dr. Hub. Today we'll look at the differences. So what is the difference between the pemphigus vulgaris? So difference between the pemphigus vulgaris versus the bullous pemphigoid. So to begin with, first we'll deal with the pemphigus vulgaris. So pemphigus vulgaris is between the 30 to 60 years of age. So what about the antibody? The antibody is nothing but it is the anti-desmoglein. This is the anti-desmoglein antibody. So what about the location of target antigens? So the location of target antigen. The answer here is it is intraepidermal. Then what about the IF, that is the immunofluorescence? So immunofluorescence is that there is a fishnet appearance, fishnet pattern. Then what about the bullae? The bullae is thin and fragile. It is thin and fragile. Now let's look at the mouth involved. Let's look at mouth involved. So under mouth involved, it includes, the answer is yes, there is mouth involved. So what about the Nikolsky sign? So Nikolsky sign, it is positive. Then what about the symptoms? The symptom is painful. It is painful. And looking at the severity, it is life-threatening. It is very dangerous. Pemphigus vulgaris is life-threatening. Now we'll move on to the bullous pemphigoid. So bullous pemphigoid, it occurs in the age group of 70 to 80 years. And what is the antibody? The antibody involved here is the anti-hemidesmosome. Anti-hemidesmosome. Now let's look at the location of target antigens. So location of target antigens. So this includes, it is subepidermal. It is subepidermal. So what about the IF, that is the immunofluorescence? The immunofluorescence, it is linear. It is a shoreline pattern. Then we look at the bullae. The bullae is deep and tense. It is deep and it is also tense. So what about the mouth? The mouth is not involved. Next comes the Nikolsky sign. The Nikolsky sign, it is negative, whereas in case of pemphigus vulgaris it was positive. So what about the symptom? The symptom is it is pruritic. It is pruritic. Then what about the severity? The severity is that it resolves. So this was about the differences between the pemphigus vulgaris and the bullous pemphigoid. To learn and grow daily, please do subscribe.